This is breaking news.
Governor Murphy is giving an update on the coronavirus pandemic in New Jersey. Let's go to that now.
Plotkin will join us in a bit. This morning, we received the weekly data from the Department of Labor. Unfortunately, due to a personal commitment, Labor Commissioner Rob Acero-Angelo can't be with us today. He sends his best. Last week, we saw the continued decline in the number of new claims being filed. Last week, that number was roughly 34,400, still a staggering amount, by the way, but a decrease of about 8,000 or about 20% from the prior week. This continues the trend that we've seen for the past 3 weeks. However, this does not take away from the fact that we have roughly 1.17 million New Jerseyans who have filed unemployment claims since this emergency began. As Rob has noted, this is nothing less than unprecedented. As of this past Saturday, so this is now 5 days ago, of that 1.17 million, 911,000 of these claims have been fulfilled and residents are receiving their benefits. Since the department implemented new programming to expedite claims, more than 345,000 of those claims have been cleared. The number of claims in the queue continues to shrink, and roughly 208,000 additional claims have been removed from pending status and are now being paid out. As you can see, during this emergency, the unemployment system has paid out a total of $4.3 billion in benefits. That includes $1.6 billion from the state UI trust fund, and with the $600 weekly federal benefit and assistance to workers who don't normally qualify for unemployment, more than $2.7 billion in federal funds have also been paid out. Quite simply, you all have paid into the system to protect you in times like this, and the UI system is there to help see you through. As the commissioner has noted each time he's been here, the Labor Department, the staff at the Labor Department, the staff continues its hard work to clear claims to ensure that every New Jerseyan who qualifies for unemployment benefits receives every single penny to which they are entitled. No one will lose any part of their benefit because of a time lag. We recognize, too, that the stress our unemployment system has felt is not just a New Jersey thing either. It is truly national in scope. The ferocity in which this emergency took hold has been felt in every single state, and we are not alone in pushing hard against record levels of new claims. The federal system, as the commissioner has noted, has its own flaws, which sometimes slows things down. But together, we're working through them to provide the financial relief and support our residents need. And I thank everyone at the department for their continued hard work, and I thank each and every one of you, particularly if you're out there we haven't gotten to you, for your extraordinary patience through this extraordinary 500-year flood, tsunami, whatever way we want to put it. Turning to the overnight numbers, yesterday we received an additional 1,261 positive test results for a current statewide cumulative total of 157,815, all since March 4th, which is day one of our first positive test. Here is the trend line of new cases. Before I go to the spot positivity, Judy, you'd want me to remind everybody, yes, while the positives are up a little bit today, our capacities have gone up to test dramatically. We'll get to that a little bit later, but our capacity to get people testing is now almost exploding. Here's the daily spot positivity. These are from samples taken on May 24th, which was Sunday, and that's 6%. Looking to our long-term care facilities, we continue to see some fluctuations in the trends of new cases being confirmed. This is a particular challenge that we continue to focus on alongside many, including the National Guard's women and men and the strike force teams from the Federal Veterans Administration, who are working hand in hand with the staffs at our residential facilities to keep people safe. As you can see, 31,312 of our positives are coming out of long-term care facilities. Meanwhile, the numbers of lab-confirmed deaths associated with our long-term care facilities continues its decrease from the peak, but let's not make any light of this. This is 4,949 blessed souls who we have lost in long-term care facilities. In our hospitals, the number of patients currently being treated for COVID-19 ticked up a hair yesterday, slightly to 2,797, and our field medical stations reported 24 patients. This is a breakdown of hospitalizations across regions, but the number of patients reported in either critical or intensive care decreased again to 740, and the number of ventilators in use decreased as well to 564. Now, to something which is a little bit troubling, and I think it's fair to say Judy, Ed, and their team are going to try to dig in on this, as we all are. There were 365 new hospitalizations yesterday, while 287 live residents left our hospitals. These are each the biggest numbers we've seen, respectively, in a week. And here are those numbers charted across the regions. As you can see, the big bulk of these were up north, both those going in and those coming out. As I mentioned yesterday, we have expected this increase in new hospitalizations given the weekend, but we are going to watch these numbers closely over the coming days to see if there may be a deeper meaning to them. And I want to pause there for a second. I don't mean the weekend in that we were worried that activity took place on the weekend that led to this, although that could be the case. I mean also, and I think Judy is digging in on this, is whether or not we've had some lag reporting in the data. I know the hospitals, I believe, are in the better be safe than sorry category. I think, Judy, when somebody walks in the door with pneumonia on the margin, they're going to assume the worst in terms of what the cause of that is. But this is something, folks, we've got to keep an eye on. And I promise you, we will keep an eye on. But for everybody who says, open the thing up tomorrow, let's turn all the lights on, let's get back to normal, you got what do we have here? 365 folks going in the hospital yesterday. We got to make sure we are watching this like a hawk. Again, so the trajectory remains largely positive. The key metrics that we're tracking continue to move in the right direction, and they, as you can see, continue to be way down from the peak. And especially over the past couple of weeks, even though we've seen some days with spikes, we remain confident in our overall direction. You can see this confidence in each region as the metrics generally follow each other across the state. Again, upper left is where Judy, Ed, and their teams, and I certainly can speak for myself, that's what we're focused on. It's also why, again, I repeat, that we look at 3- and 7-day rolling averages, because you could have a distortion from one day to the next. A green ball means things went down, that's good. Red ball means it went up. Again, when you've got holiday weekends generally, we need to smooth the data, but new hospitalizations is something that we are very much looking at. Again, if you want to be a little bit more sober, compare us to our peers. We continue to lead where we don't want to. So this is a reminder that we not only are not out of the woods, but also that we must continue to practice social distancing. I'm now becoming every day, I see you, an even bigger believer in face coverings, washing hands with soap. We added on this chart today for the first time where we rank nationally. So you can see new cases of COVID-19 per 100,000 residents. This is per capita. We're 10th in the country. Patients in the hospital per 100,000, we are number 1 in the United States. And new deaths per 100,000, we continue to be number 2 in the country. So we are clearly digging out of this. And folks, it's all because of you. You did everything we asked of you. You flattened the curves. You stayed home. You kept away from each other. You covered your face. You washed your hands with soap and water. You allowed the healthcare system to stay functioning. You did an extraordinary job. But having said all of that, we're the densest state in America. We continue to be part of the dense ground zero metro New York City reality of this awful virus. We are still digging out of this. We've made an enormous amount of progress, but we are still digging out. Today, we must announce with heavy hearts, another 66 of our fellow New Jerseyans have passed due to COVID-19 related complications, and our statewide total stands at what is now an almost unfathomable 11,401 lives lost. Let's take a couple of minutes to remember a few of those we have lost. I want to begin with Richard Dick Hogan. There's a face, huh? Dick lived his whole life in Neptune Township. He was a highly respected attorney, recognized as a leader within numerous community and charitable organizations. He was, by any measure, bigger than life. He was raised to know the value of work, being by the side of his parents in their restaurants in the Ocean Grove South End concessions. He graduated from Wagner College, but even more important than his degree, he met his wife of 52 years there, Erica, with whom I had the great honor of speaking yesterday. After finishing law school in 1970, he started his legal career in Asbury Park, then moved his practice to Ocean Grove's Main Avenue, where he stayed. And in addition to his regular clients, he offered pro bono services to many across the Shore communities. Dick was a past president of the Shore Area YMCA, a member of the Lions Club, former board member of Jersey Shore Medical Center, Monmouth County Blood Bank president, and served as president of the Monmouth Park Charity Fund. He was also a member of the vestry at Asbury Park's Trinity Episcopal Church. Dick was 75 years old. And by the way, I did not know Dick, but I'm a Monmouth County guy, and he was a legend in Monmouth County. He leaves, as I mentioned, his wife Erica, with whom I had the great honor of speaking, their 3 sons, Richard, Jeffrey, Kelly, and their families, including 5 grandchildren and many nephews, nieces, and cousins. He leaves behind a legendary ornate law office, and Erica and I agreed that, assuming we get this virus out of the New Jersey system, I would have the honor of touring that with her. God bless you, Dick, and God rest your soul. Next up is Lyndon's Marty Kennedy. There's a look, huh? I believe he's Irish, Pat. Marty was a skilled machinist for Hyatt Roller Bearing in Clark for many years before taking a job with General Motors in Linden, which he held for 20 years before his retirement in 2006. He was a proud member of UAW's Local 595 and enjoyed attending monthly meetings and organizing lunches alongside former colleagues who had become by then lifelong friends. He loved to golf and to spend his summers in Harvey Cedars on Long Beach Island, one of the great little communities in our state. Cars weren't just his vocation either, by the way, but also his hobby. He was often seen at car shows and cruise nights, driving and showing off his cars, including a 1958 Chevy Bel Air. It was hard to go anywhere with running into someone who knew Marty. He is survived by his daughters, Lori and Janet, and I had the great honor of speaking with the 2 of them yesterday, and Lori's husband, Jim, and Janet and her husband, Matt, and his grandson, Griffin, his former wife, Joanne, with whom he remained close all these years, along with many close cousins and friends. Marty, God bless you, God rest your soul. He was 78 years old. You hang in there. Finally today, we remember Asha Pritam Badlani of Hasbrook Heights in Bergen County. And this was a particularly tough one. This family has been rocked, to say the very least. For 28 years, and that's her right in the center stage there. For 28 years, she worked for the U.S. Postal Service, a well-known clerk and a fixture in the West Caldwell Post Office. She retired only 3 years ago. She was a spiritual woman for whom family came first, especially if it meant spending time with her granddaughters. Asha loved to cook for others as well. Her son Ashish said he'll remember his mother as, and I quote him, gracious, full of joy, and a humble person who always welcomed everyone. Asha leaves behind her husband Pritam, who, by the way, himself is currently in the hospital for an underlying condition, and please keep him in your prayers, along with her children, her son Ashish, who I mentioned, by the way, he's in Elmwood Park. He was hospitalized from this awful disease. Mohit, who is in Hoboken, and her daughter Serena, with whom I had the great honor of speaking, who hails from Paramus. She herself had tested positive. Also Serena's husband, Natik, and Asha's beloved granddaughters, Sahana and Naya. This is a family, by the way, that was incredibly close, remains incredibly close, and has been rocked by COVID-19. Please keep all of them, especially Asha's memory, in your prayers. 3 more tremendous members of our unique and diverse family lost. 3 more families left mourning, and we mourn with them as if they were our own, because in every way, in fact, they are. We are one state, one people. We rise and we fall as one. And as we move forward together in the days ahead in our restart and recovery, we cannot forget the tremendous toll that COVID-19 has had on our family. And we cannot forget those who will not be with us as we, individually and as a state, rise again. Switching gears, a couple of developments since yesterday. We had a very good, I thought, exchange, about 45 or 50 minutes with legislators from both sides of the aisle. Judy and Pat joined me. I thought the conversation was a good one. The questions were good, a lot on things like youth sports, small businesses, dining, outdoor, and a whole lot of guidance both tomorrow and in the coming days on where we're headed. But I thought that was a really good exchange. And again, I want to salute members of both sides of the aisle for being as responsible and helpful as they've been. Had a couple of good conversations with union leaders this morning. The conversation started out with a different objective, but they came back in each case to a theme that you've heard from us almost every day, and that is the need, the absolute overwhelming need to keep firefighters, police, educators, EMS, healthcare workers employed at the front lines when we need them the most for federal direct cash assistance. I was on with Lee Saunders, who runs AFSCME globally, as well as Terry O'Sullivan, who runs the laborers. And they come at this from different perspectives, right? So Lee's got a huge dose of municipal, county and municipal workers, as well as obviously some for the state. Terry comes at it from the laborers' side, but also, by the way, has 50,000 members who work in the Postal Service. Not the letter carriers, not the folks behind the windows, but the ones in the warehouses who are sorting through the gobs of packages and mail that we deal with as a country every day. That federal cash assistance is needed. And it's not just New Jersey, it's not just blue states, it's not to deal with legacy issues, it's for the here and now, for red and blue, for American states, and to keep our folks employed at the point of attack. Switching gears, over the past several weeks, we have highlighted the need for every New Jersey resident to answer the 2020 census. The more residents who respond online means the fewer residents who may have to receive a knock on the door later this fall. But as we have noted, the census is not just a count. It's about much more than numbers or drawing federal, congressional, or state legislative district maps. The census determines whether or not New Jersey will receive billions of dollars in much needed federal funding, as I just mentioned. And if you don't get counted, it means that we leave money on the table that will go to some other state. We know for a fact that we were undercounted in 2010. And because we lost out on literally tens of billions of dollars in federal aid and grants. As we begin our restart and recovery, that's a hole we have to work even harder to pull ourselves out of. So first and foremost, if you have not yet, go to 2020census.gov and be counted. And then please do me another favor, go and reach out to 5 family members or friends or neighbors. Check in, first of all, to make sure that they're safe and healthy, and then urge them to be counted as well. You are their most trusted voices. They'll believe you. And you can help us spread the message that the census is about strengthening our communities and being able to provide for our families. It's about your neighborhood. It's about your children's or your grandchildren's or your nieces or your nephews' schools. And as Judy can attest, it's about being able to provide health care and basic needs for healthy families. We're doing a pretty decent job, I have to say. In New Jersey, bless you, bless us all. Right now, we're at 62.2% already responded, and that's a full 2 points higher than the national average. But we're still trailing 20 of our peer states. We know we can be number one. I've set an objective to at least be in the top 10, if not to lead the nation. And across the entire Northeast and Puerto Rico, by the way, the top 4 reporting counties are all in New Jersey: Hunterdon, Morris, Burlington, and Somerset. And by the way, Gloucester County is right there at number 11. That's huge. Those are all badges of honor. But we need every county to get on this list. There's no reason we can't hold the top 21 spots in all of our counties. So again, take a few minutes and go to 2020census.gov to be counted. Then make sure your family and friends are counted as well. An accurate count is absolutely vital for our state and our communities. Remember, the census is not just a number. It's about our ability to keep our New Jersey family strong. Next, I want to go back briefly to what we discussed yesterday about testing. Over the coming days, as I've noticed, we are preparing to keep moving confidently on our restart and recovery. And the reason we're able to do so is because we're getting the data we need to determine the dates when we could take specific steps. Our hospital data, for the most part, not entirely, but for the most part, is strong. But we also get tremendous data from testing. So I reiterate what I said yesterday: go out and get tested. The more data we have, the more confidence we can have that it's time to move forward. We were back above 20,000 tests, as I think I alluded to this off the cuff yesterday, recorded on Tuesday. Over 24,000, in fact, to be exact. That's a strong way to start back from the long holiday weekend. Because of this, we now rank third in the entire nation in terms of tests per capita, in this case, tests per 100,000 residents. We've worked really hard to get our testing program to where it needs to be, and we're going to continue to work to make it even stronger and more accessible. Whether it be at our federally partnered sites or a county or locally run one, or at a Rite Aid, a CVS, a Walmart, as of tomorrow, there will be 208 sites open to get a test. I encourage you to go to covid19.nj.gov/testing to find a location near you and to go out and get tested. Now, before I close and turn things over to Judy, I want to recognize one more young person who deserves to be in the spotlight. This is 10-year-old Isabella Raju from North Caldwell. She already knew that she loved to run and decided a month ago that she was going to set a goal to run 100 miles in 4 weeks to raise money for the first responders in her hometown. Isabella completed her run a week early. Admittedly, the last miles were a little different, as she got an escort to her finish line at the West Caldwell Municipal Building from the West Caldwell Police, Fire, and First Aid departments, and apparently Batman there on the left. Isabella has raised more than $3,000, with more still coming in. So to you, Isabella, thank you for your determination and community spirit, and congratulations. With that, please help me welcome the woman who needs no introduction.
You've been watching Governor Murphy give an update on the coronavirus pandemic in New Jersey. We are now returning to regular programming on CBS 2. For extended local news coverage, you can stick with our streaming service, CBSN New York.